The Folic Acid-B Cplx-C-Selen-Zinc Tablet is a combination of B vitamins that are essential for treating or preventing vitamin deficiency. This can occur due to a poor diet, certain illnesses, alcoholism, or during pregnancy. These vitamins are important for maintaining good health and are vital building blocks for the body. In addition to B vitamins, some brands of this tablet also contain ingredients such as vitamin C, vitamin E, biotin, or zinc. It is important to consult with your doctor or pharmacist if you have any questions about the specific ingredients in the brand you are using. This tablet can be beneficial for individuals who may not be getting enough B vitamins from their diet, or for those who have increased needs due to certain health conditions or pregnancy. The recommended dosage for this tablet may vary depending on individual needs and should be determined by a healthcare professional. It is generally recommended to take this tablet with food to help with absorption. Always follow the instructions provided by your healthcare provider for the best results. Remember to consult with a healthcare professional before starting any new medication or supplement. When taking the Folic Acid-B Cplx-C-Selen-Zinc Tablet, it's important to follow the directions carefully. Usually, it's taken by mouth once daily, or as directed by your doctor. If the tablet contains vitamin C, be sure to take it with a full glass of water, unless instructed otherwise. Chewable tablets should be thoroughly chewed before swallowing, while extended-release capsules should be swallowed whole, without crushing or chewing. Liquid products should be carefully measured with a medication measuring device, and some may need to be shaken before each dose. If the product contains vitamin B12, it may need to be placed under the tongue and held there before swallowing. It's important to follow the label directions to get the most benefit from the medication. Taking this medication regularly at the same time each day will help you get the most benefit from it. If you have any questions about how to take this medication, be sure to ask your doctor or pharmacist for guidance. If you experience mild upset stomach or flushing, it's usually temporary and may go away as your body gets used to the product. If these effects persist or worsen, talk to your doctor or pharmacist. Serious side effects are rare, but if you notice symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that many people using this medication do not experience serious side effects. However, if you notice any other effects not listed here, talk to your doctor or pharmacist. Now, let's talk about the benefits of Folic Acid-B Cplx-C-Selen-Zinc Tablet. It is commonly used to help prevent or treat a lack of these nutrients in the body. This medication may also be used for conditions such as anemia, pregnancy, or certain types of nerve damage. The daily dosage and optimal timing for taking this medication will depend on your specific condition and medical history, so it's important to follow your doctor's instructions. If you have any concerns or questions about taking this medication, be sure to discuss them with your healthcare provider. Before taking the Folic Acid-B Cplx-C-Selen-Zinc Tablet, it's important to consider any allergies you may have to its ingredients. This product may contain inactive ingredients that could cause allergic reactions, so it's vital to discuss this with your pharmacist. If you have diabetes, liver problems, or a vitamin B12 deficiency, it's also essential to consult your doctor or pharmacist before using this product. If you're considering the chewable tablet or liquid form of this product, it's important to note that they may contain aspartame. If you have phenylketonuria, PKU, or any other condition requiring you to restrict your intake of aspartame, make sure to consult your doctor or pharmacist about using this drug safely. Additionally, the liquid form may contain sugar and/or alcohol, so caution is advised if you have diabetes, alcohol dependence, or liver disease. Make sure to discuss this with your doctor or pharmacist for safe usage. If you have a surgery planned, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, it's important to consult your doctor before using this medication. When used as directed, this product is safe to take during pregnancy and may help prevent certain spinal cord birth defects by maintaining adequate amounts of folic acid. It's important to consult your doctor or pharmacist for more details. Lastly, for breastfeeding mothers, it's important to note that this product passes into breast milk. While there have been no reports of harm to nursing infants, it's crucial to consult your doctor before breastfeeding. When taking Folic Acid-B Cplx-C-Selen-Zinc Tablet, it's important to be aware of potential drug interactions. Some products that may interact with this medication include altretamine, cisplatin, certain antibiotics, certain anti-seizure drugs, levodopa, and other vitamin/nutritional supplements. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Additionally, this product may interfere with certain lab tests, potentially causing false results. It's important to make sure that lab personnel and all your doctors are aware that you are taking this product. As for the benefits of Folic Acid-B Cplx-C-Selen-Zinc Tablet, it is commonly used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. The daily dosage and optimal timing for taking this medication should be determined by your doctor based on your individual needs and medical condition. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or your local poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. Be sure to keep up with all your medical appointments and lab tests. It's important to note that this tablet is not a replacement for a balanced diet. It's always best to get your vitamins from nutritious foods. B vitamins are naturally found in leafy greens, vegetables, meat, fish, poultry, and enriched breads and cereals. So, make sure you're also eating a healthy, well-rounded diet to get the most benefits from this tablet. If you forget to take this product at your regular time, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take your next one at the usual time. There's no need to take a double dose to make up for the missed one. It's essential to take this product consistently for the best results. Make sure to check the storage information on the package and consult your pharmacist if you have any questions. Keep this medication out of reach of children and pets. Do not dispose of this medication by flushing it down the toilet or pouring it into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.